Welcome back to Keep It Healthy podcast. In today's episode, we're thrilled to have Sarah Bell, a standout in the digital health arena. As a former Vice President of Product and Clinical Implementation at Biofourmis, Sarah brings an impressive background in virtual care services and over 18 years of leadership in healthcare. With her roots in clinical practice and healthcare management, she played pivotal roles at Mayo Clinic and Biofourmis' innovative care home strategy. Her dedication shines through in her work, aiming to improve patient outcomes and care quality through technology. Today, Sarah will share her insights on the evolution of digital health and how technology is reshaping patient care. Let's dive in and discover the future of healthcare with Sarah Bell. Welcome to Keep IT Healthy podcast, the show hosted by people making things happen in technology, aiming to optimize healthcare delivery, health, well-being, and fitness. My name is Jan Kamiński and I'm the co-founder of AppLover, a company dedicated to improving the quality of life with IT solutions and digital advisory. We started making this podcast to amplify great thinking to propel healthcare forward. Of course, some of our audience might be familiar with the EICU, but how does it work?
So EICU really as a concept started in the early 2000s from a couple of physicians on the East Coast. And they started their own company even to kind of empower this concept. And so the concept is that we know patients receive better care in the ICU if an intensivist or a critical care trained team is in charge of their care. And we also know that those resources are limited. And so health systems and hospitals don't always have access to that type of expertise. So EICU was kind of born with the thought of academic medical centers having a hub or a command center where they can virtually enter patients' rooms at different facilities throughout the country with AV solutions in the room. And then they're able to really provide that expertise so that patients have better care equity when they're in the ICU, have better outcomes, reduce mortality, reduce length of stay. And really, this was the first time as well that we realized that data and streaming data and trending data and having a care team that's virtual, that is, kind of providing that pilot. They're the pilot. They're watching the overall care of the patient. And then the boots on the ground are caring for the patient's physical needs and orders and medications. And they're in the weeds of patient care, that combination of care leads to better outcomes in patients.
If you have that, let's say, I don't know if you had this data, but how many institutions and hospitals actually use that? And I know it's as a trend. I mean, is it like 20%, 50 or 80 actually is using solutions like that?
No, it's probably not even close to 50%. And that's the problem with digital health solutions, right? There's often a cost associated with doing that. And what does that lead to is institutions that have the bandwidth or the financial capability to have these types of solutions. They're the ones that are able to do it. So it's not even half of health systems around the country have this type of support.
Since we are at the challenges, because as I understand, finance is one of the reasons why institutions are not implementing virtual care services. But what are the other most significant challenges that you face in implementing that in your career?
Any inpatient virtual care solution like EICU or virtual nursing, where we have remote care team members accessing patient rooms by video and performing offloading tasks for the physical team. So they might be checking drip rates on pumps and checking that with the order. They might be educating the patient, having an interaction with them so that the physical team can care for the patients who physically need them. And often when we're deploying these types of services, the pushback from the ground team is, well, patients they want a person to care for them. They don't want somebody over a camera to care for them. And what we found is that's generally not true. Patients want the right kind of care when they need it. So if their need can be fulfilled by somebody remotely and it gets done faster because they don't have to wait for a person on the ground who's caring for the patient in front of them that needs them most, they want the care that way. If they're not doing well and deteriorating and they require an in-person team, they want an in-person team to be there. And they want that in-person team to be able to focus on all of their needs, not be worried about, shoot, I have to give the meds or give the discharge education to the patient next door, and all of the other things that kind of can creep in because our healthcare teams are stressed today, have a lot going on. They're taking care of more patients than ever before, and they're taking care of sicker patients. And so I think that number one is the concern that patients aren't going to like it. We know that's not true. The second concern is that the on-the-ground team can sometimes feel like they're being watched. That, well, this virtual person is going to be watching what I'm doing. They're going to be checking. It's going to be punitive. And really, you can overcome that by not creating an environment where it's punitive if somebody catches an error or catches a med going at a wrong drip rate. We're better off as clinicians if we find those things and if we create processes about how to prohibit them in the future, and creating that kind of safe environment where errors or things that go wrong are seen as a learning opportunity and as a way to improve process rather than a way to create strife amongst team members and create a punitive environment. And then I think also another common reason why institutions don't go forward with a type of virtual care program is because they feel they're already short-staffed today, and they feel like they need all of the staff possible to physically care for patients. And what we know is that if you deploy a virtual care program, you're actually creating a more sustainable workforce internally. It's hard caring for patients physically every day, day in and day out. And so creating an avenue for which your experienced staff can be providing virtual care for periods of their shift and periods of their FTE is really a sustainability strategy in the workforce. It's also a way to combat and spread out expertise, where if you have units where there's a lot of new grads or a lot of inexperienced staff, you're able to provide that experienced staff virtually and cover more patients. So really, those are the main concerns that people have before going into this adventure.
You mentioned quality of care, but what about the fear of those patients about the quality of care? You just mentioned that some patients prefer to be cared for on site. What about that fear of those patients?
So certainly not every patient, it's all in delivery. So patients feel connected to their care team, and if they're stressed about what's going on, the patient's going to feel stressed about it. So it's an approach. If the nurse comes in the room and says, well, I have this virtual nurse and I don't know why we're doing it, but I have to let them get involved with your care. They're going to come in and ask you a bunch of questions. I'm not sure what's going on. That's going to put the patient on edge. So creating staff buy-in so that the staff see it as a positive to them, and they can come in and say, hey, my colleague is virtual. They're going to come in and help me out and ask some questions. And then we're going to tag team your care today. That type of an approach allows the patient to see, oh, okay, this is part of my care. And then the biggest part is when the patient can get the care they need when they need it, like discharge education. The virtual nurse can spend more time providing that education. So if they're getting all that information and reducing a readmission later because they were able to care for their surgical site in the right way, or they were able to provide, the right type of regimen in their home, that's getting the right care that they need in the moment. Busy staff on the unit, they're caring for the physical patient first, sometimes pushing paperwork to a patient saying, here's your instructions, call this number if you need anything. And that's understandable, because if you're on the ground, the patients who need you physically there take that priority.
You mentioned the staff, but based on your experience, what strategies have you found most effective for engaging healthcare professionals and patients with new technology solutions like EICU?
Yeah, so using EICU and virtual nursing as an example, I think one really good strategy to get buy-in is to have staff members on the unit that are receiving the monitoring to also be as part of the monitoring team. So they can be in the command center one day providing virtual care, and on the physical unit providing physical care the next day. And that allows their colleagues and coworkers who have respect for them on the physical unit to say, oh, they're in there, I trust them, this must be okay. And allows for that team to feel like they're a part of it as well. So I think that's strategy number one. It's change management 101, allowing the unit to participate in the change. I think the other piece to consider is to not do too much when you first implement a virtual program. Make it simple. There's a couple of models emerging of virtual nursing today, and it's task-focused models or kind of expertise resource-only models. And on the task-focused models there that are emerging, it's really the virtual nurse doing specific tasks. And everybody knows what the virtual nurse is going to do, so that there's no need to communicate over and over again between the team. The floor team knows the virtual nurse is going to do the admission questions. They're going to do any patient education. They're going to do the patient discharge education. And we have these kind of lanes of operation that allow everybody to work seamlessly together. And so having a clarity in what the virtual team is going to be doing versus what the physical team is going to be doing and having buy-in on that is huge. And then I think also having data to support why we're doing this. So surveying staff, allowing feedback so that you can change and move, education. I think those are really three key strategies to implementing any type of program like this.
Okay, and regarding the data, and given your background in healthcare data and analytics, how do you see that translating to the improvement of healthcare apps in general? Of course, telehealth as well, because you just mentioned the third strategy to just analyze it. Is it a vendor that analyzes it? Is it an institution or people that actually work there? What's the best way to implement that strategy?
Right. So data is important. Data informs us that the change in care that we're doing is not harming in any way. I wrote a paper about our virtual nursing implementation at Mayo, and we talked about, we compared our units that went live with virtual nursing versus equal counterparts that did not go live with virtual nursing. And our first goal was to not impact patient care. So to totally change the model of care by adding a virtual nurse into the mix and altering the care model to include a virtual nurse, but to not have any change, good or bad, in patient care, in patient outcomes. And we were successful in that. And I think all too often people think that you're going to implement a change and totally upend the apple cart in terms of how we've always cared for patients, and that immediately you should see better patient outcomes. That's just not reality. And so considering no change a good thing, that we've carefully created a new care model by not changing any part of how the patients are feeling about their care, from patient satisfaction or from patient outcomes. And so there's a host of ways to go about data. If you're, work for a vendor like I do with Biofourmis, we have data embedded throughout all the things that we do. We make the data available to our customers so that they can manipulate the data. I think as institutions who are starting these models, creating data sets that you're reviewing regularly is important. So you want to check patient satisfaction, staff satisfaction. You want to make sure your unit length of stay is not altering in any way. You want to track mortality rates and make sure that patients aren't having any adverse outcomes. I think another good outcome of virtual care is the event rate. We saw an increase in event reporting when we started virtual nursing, which we considered to be a good thing, because that meant that our virtual nurses were catching things that wouldn't have been caught before. And subsequently, we saw events of some medication-associated, adverse events going down as a result of that. So having a good data set that you review regularly, and then we have to publish. If we don't have data out there being published, these newer care models aren't going to continue to move forward. And it's really important for the future of our workforce.
At Biofourmis, I know you lead a product and clinical implementation strategy for care home. Could you explain what's that, and how is it also answering the patient needs?
Biofourmis is a digital health company, and we provide a platform to help care teams provide care, virtual care, predominantly in the patient homes, although now it's creeping into some inpatient scenarios as well. So the platform allows you to provide care virtually to a larger number of patients. So we allow audio video interactions via a tablet or phone that we send to patients, or patients can leverage their own device, download our app, and have that portal to their care team. We provide peripheral devices for monitoring, whether it be patches or armbands or watches or episodic devices. So a suite of continuous and episodic data. And that powers use cases like remote patient monitoring, where you're caring for discharged patients in their home, hospital at home, where you're providing hospital level care in the patient's home, or what we're calling kind of timely discharge or early discharge, where the strategy is hospitals are full, they need capacity for sick patients who need their care. And so we can leverage our platform in a way to get patients out 1 or 2 days earlier and implementing in-home services. So whether it be in-home nursing care, infusions, wound care, imaging, those types of things that would have normally been done on the last 1 to 2 days of hospitalization, but now can be done to their home. So it's a mechanism to improve throughput.
And it's B2B model, right? I mean, that's the model where it's implemented.
Correct.
Okay. And talking about this, let's say, trend of telemedicine, EICU, virtual health, we obviously talked about the advantages, but where do you see the threats, in a sense? How do you think this industry will look in 3 to 5 years, and what's the biggest threat?
That's a really good question. I think the major threats to this space is the cost associated with implementing it. So our reimbursement models today from insurance or CMS or, do not supplement the cost that it takes for a healthcare institution to implement these types of services. And so a lot of the way that healthcare institutions today justify adding this type of cost is in cost savings. So if you get a patient out 1 to 2 days earlier and you still get that full DRG payment, you can bring a new patient in and get their full payment. So you're having a shorter length of stay. The other piece is, we need equity in this space. Health systems that have a lot of money or that, are big enough to support this type of work do so, and they see the benefit of it. But we're not seeing that in a lot of smaller community-based health systems. And so to say that those health systems don't need this type of care, I think is a big risk. And so some type of grants or funding that can facilitate these programs in smaller, more rural-based healthcare facilities, I think is huge. It's an equity issue today that most of our health systems across the nation doing this type of work in any way are more urban areas, large footprints across the United States. So I think that's a risk to it. I think in the next 3 to 5 years, it's going to be absolutely necessary for any and every health system to do some type of virtual care for a couple of reasons. One is staff sustainability. You have to create a strategy for bedside staff to rotate through a different type of work. Patients are more violent today than they were before COVID. We know our hospitals are fuller than before COVID, and our staff are burned out due to staffing shortages. So we need to have some diversity in how they're working so that we can have sustainability. We also need, as our baby boomers are retiring and we're seeing that experience leave the bedside, we need a mechanism to expand that expertise across many patients. So I think having virtual care of any type is going to be an absolute strategy from a workforce stabilization. And then I think what's going to be interesting, coming up in the next 3 to 5 years is going to be the amount of patients who maybe determine that they want virtual care as a part of their care. How can they sign up for a virtual care program and even pay out of pocket, or even if you think about it in the healthcare and fitness industry, you can sign up for Weight Watchers or Noom or a whole host of weight loss programs for a monthly fee and have coaches. And that I do think these kind of boutique approaches to healthcare are emerging. And I think in cancer care or in other types of care where patients often are navigating a very complicated space, I think they would sign on to a subscription-based model to help monitor their care moving forward. So I think those are the things to watch out for.
I want to cover this topic of patient feedback, especially since you're on the product side and you were on two sides, in a sense, first in Mayo Clinic as a institution, as a hospital, and now on the vendor side, we're obviously having, a lot of our audience is in healthcare, dealing with patients on a daily basis and also dealing with technology. So about this, how do you incorporate patient feedback into the design and the iteration of healthcare services or products now, and how you did it on the other side, in a sense.
So when I was on the health system side working for Mayo, I was a visionary in terms of very bought into digital health, right? I've been doing it for almost a decade of my career, understood how to scale and how to move. And I think a big mistake that can happen today in health systems or people who are not experienced in virtual care and trying to lead these programs is they try to make a one-to-one replacement of what you do in person with what you do virtually. And you're missing out on a whole host of efficiency opportunities. So in my role today, being in the product space, I take feedback not entirely from patients, but mostly from healthcare institutions who want to make a change to the product to better or, make a perceived improvement to their program. The hard part is determining what is a product enhancement or feature that's going to scale. We have limited engineering resources. We can't do everything that every health system or every customer wants to do. And so it becomes, you start to ask yourself some questions. Will this request help us scale? And can it be usable across many different customers? Because you want to really focus efforts that are going to do that. But then I think we have to leverage our expertise in the space, and mine having done this for a really long time and being able to articulate to customers sometimes the requests that they're making and help educate them and how do we move differently? What are the things that are going to get you to a better spot? And that might not be what they're requesting today. So I think a huge thing that we've moved to at Biofourmis that I've helped move forward with is creating some standardization. And when we implement, creating a standardized pathway that clients can follow. So rather than saying, hey, how do you want to implement this, customer? We say, hey, this is how we implement this. This is the procedure. This is how we build this. This is how we do. And then we find that maybe health systems or individuals that aren't quite as experienced in the space are welcoming that direction and we'll just follow it and like, okay, this is great. And then we can make sure we're having some standardization in the product and in the way we're doing it. And we eliminate the menu that we could provide customers, and they're taking us down many different pathways.
Can you share an instance where patient or user feedback led to a significant pivot or improvement in a project or product that you were leading or a service?
When I implemented virtual nursing at Mayo, we were really good about, sending surveys and really understanding how the unit staff were perceiving our services. And when we went live with what we felt like was the right way to go about it. It was throw a dart at the dartboard. There was no path. There was no path already created. I was using my experience from EICU and implementing that and kind of bringing it to the virtual nursing space and gen med units. And so what we went live with week 1 changed week 2. Based on feedback, changed week 3. And we really were open to the fact that what we go live with, it will change. If you go live with something, you can 100% guarantee you're going to iterate and change. It will never be the same way on day 1. So if you go into it with that mindset, I hope that everything we implement changes because I want to iterate. I don't want the team to be stuck in a workflow that doesn't work. We thought when we went live with virtual nursing that it was a good idea to have the virtual nurses just there as a needed resource. So we were like, we're going to deploy this. The staff nurses are going to use us. They're going to call us, and then we're going to have work to do. And what we found was that week 1, nobody called because we were changing the way that they were working. They didn't have time to think about when to call us and ask for help. They were still doing their normal thing throughout the day. So we were being included. So what we changed to was creating this is what the virtual nurse does, these 5 things every day, every time. And this is what the physical nurse does so that everybody had a clear lane of operation. So there didn't need to be a phone call so that everybody could work within their lane and move at the same time. And so that's kind of like one example of a simple workflow change. And I think it's also important to know that like just changing a product doesn't mean that you're going to actually change human behavior. We often think that if we do this one great thing that everybody's going to use it. And that's not the case, because human behavior is you get into a rhythm, you get into a way of working, and that's what you do. Whether it's the most ridiculous way to go about things or not, you are used to doing something one way, and you're not just going to change. So even with product changes or with changes that we make to the platform, we have to create a change management strategy so that people can adopt that new way of working and gain efficiency. Otherwise, we're making changes that aren't impacting workload or workforce.
In Mayo Clinic, you started you were managing the tele ICU program. But for anyone listening that is considering to implement, let's say, a system like that or a process like that, what would be the North Star metric that they should follow and they should really look into?
Ooh, that's a really good question. I think that one of the most underlooked kind of resources in developing any type of virtual care program is the involvement of the nurse. The nurse is the person who steers the ship of patient care. They are with the patient all day, every day. And so one of the things that I am very thankful for when I worked at Mayo is that I, as a nurse, was in charge of the ship, of doing virtual nursing, of leading EICU. And I was able to then create a solution with my nursing hat on so that the nurses at the bedside or that were the receivers of the care felt like a solution was being developed to help them. Now at Biofourmis, I'm the vice president of product and clinical implementation. And so I essentially help lead a $10 million engineering team. And my hat as a nurse is able to help bring efficiencies to the nurses who are the main interacting parties with our platform. And so I think it's a new day for nurses in the sense that, and that I'm really excited about it, that we can be involved in things like this, that we can take charge of healthcare solutions and help our profession, which is just hurting right now, and really build and design solutions that can facilitate a better workforce and a better working environment for our care team. So I think that is the key thing, is who leads this, that can translate the model to the team that has to adopt it.
You also said that at the beginning that that's the wrong strategy if the nurses or the staff is opposing the new process or the system or the tele solutions that you implement. But is it easy, or what's the best way to train them? I mean, how to convince your staff if you're not really that digitalized?
So staff will use a new solution if it helps them. We like to think that they care about decreased length of stay and mortality, and they do care about that. But if those metrics are achieved by making them work harder in a perceived way that doesn't add value to them, we lose them really quick. So I think the number one way to ensure success in these programs is to have staff surveys frequently, monthly, and then move to quarterly, so that you can assess how it's going and make changes, because you want a seamless integration into the staff's workflow. If they're not seeing benefit right away and it's making their day harder, they're not going to use it. Which is why when we implemented virtual nursing, and the first way we implemented required the physical nurse to reach out to us and ask for help, why it didn't work. It's adding a task to them to ask for help when they're so underwater, they can't possibly know where to begin or start. And so I think that staff survey is key. Once you get it right for the staff and understand the feedback and go through change management, have them involved in the process, have them come see how virtual care is provided, so there's that understanding, I think then you can move towards driving shared metrics like reducing length of stay, improving processes, getting your other metrics going. But to start there, I think is a poor strategy, because you need staff engagement in order to be successful.
Mm-hmm. And on the product side, because you mentioned you're running a really big team, a development team, because obviously you have experience in healthcare, but how do you foster innovation and creativity within your teams, especially when tackling complex healthcare challenges that we were talking about in development teams?
So we start a lot with user stories. So a lot of what we have to do is help create that story or that epic that the engineering team can kind of latch onto and see a design and understand what we want it to do and why. And so I think having being heavy in the user story department and really building out how you want things to flow is step one, and really building out the where are we trying to go. You can do a lot of really cool things with an engineering team. I mean, they can build anything you want, but you have to have a vision and a strategy for where you want to go. So what metrics are you going to impact? So at Biofourmis, as an example, one of our big KPIs is improving nurse to patient ratio. And I say that meaning if our nurses who are doing these virtual care services can care for more patients, but not work harder, I don't mean that they should care for more patients and have to bend over backwards to make that happen in an unrealistic work environment. On the digital health side, I should be able to leverage and create a platform where they can work, they can improve and care for more patients without working harder. I should be able to do that digitally. And so we have to have a strategy that we're working towards and some KPIs associated with that. And then everything that comes in, because we have to say no, we can't do everything. Everything that comes in, we have to tie to those goals and where we're trying to go. And if you do that and you have that type of strategy and vision for the future, then you're making the most out of your engineering resources and team.
I want to talk about also the future. So looking ahead, in your opinion, what emerging technologies that you believe will have the biggest impact on healthcare? We can focus on a more general approach to that.
So I think the future is in generative AI, and I'm super excited about generative AI and what it can do in healthcare. In healthcare today, what we've done is we've created a system with EHRs and everything and billing systems where we're relying on people to take data, whether it be from an interview with a patient in person or video or a phone call, and then they're taking that data and they're going to a computer and they're trying to recall or remember from notes or whatever, or it's going through their own interpretation while they were trying to think of other things that they had to get done for the day. And they're like putting in data into discrete fields in an EHR. And all of that can be done through generative AI. All of that. So I think that in generative AI and allowing an environment where we have a virtual assistant or kind of a co-pilot that's always working with the clinician, that is able to take data from the EHR, that's able to listen to conversations and be their co-pilot for the day, tee up, hey, you were on the phone with patient X 4 months ago, they had a video visit for the same thing, you should consider Y. Things that AI can do that as a human, I'm not going to go back and read 7 months worth of notes and understand that they had the same issue and that this has been trending over time and things like that. I don't have enough time in the day for that. I'm in the moment for what's going on with that patient. I'm going to make a decision on it. So I'm really excited about the future there and the progress being made in that space. And I think there is so much landscape coming and so many cool things that could be coming on the pipeline that I think that's going to be the biggest impact to our healthcare system.
Okay, what about privacy there when it comes to, especially that it's the most regulated industry in the world, probably, healthcare?
It is. It's very regulated. I think the issue is going to be if our clinicians accept it and accept it in a way where it's helpful to them and they're, willing to leverage it and use it, I think that it's going to go places once you have buy-in. I think from a privacy perspective, yeah, we have to be careful and we have to make sure that we're not creating vulnerabilities because it's going to take one data breach or one issue to happen that can kill all the progress happening today. So I do think we have to be cautious and careful as an industry as we move forward. But I also don't think that should stifle where we need to go. We know that we're not going to have a workforce we're going to continue to have workforce shortages. The baby boomers are going to continue to retire the next 10 years. We have to be able to care for patients. And what's going to suffer if we don't come up with solutions that can facilitate this type of care is patients, their outcomes, their we know cancer care and cancer at a rate is growing nationally and across the world. And so we have to be able to come up with better ways of working so that we can sustain the workforce, but so that we can also leverage solutions to help mine data for us so that we can make the right clinical decisions. I think it's just going to be critical.
And for other product owners, managers in healthcare, how do you stay updated with the latest trends? I mean, where do you seek knowledge and how do you apply these insights to your work later on?
I'm a novice in the product space. I mean, I'm a nurse and I spent 18 years at Mayo Clinic being a nurse and in nursing leadership and leading virtual care. But in terms of now owning product, that has been an incredibly fun journey. I didn't realize how fun it would be to be in the product space. I think an important piece of advice for any clinicians who are entering the product space is to know you're going to be a novice. You're not going to be a product expert, but your value is in translating what needs to happen from a product perspective in the clinical sense and making sure you're leveraging your clinical expertise in that way. I mean, the way that I stay up to date, I mean, I read quite a bit, but then I also make sure that I'm open to feedback and create an environment where my team can say, we don't know that that's a great idea. And we can have really healthy conversations. I never want to come in and be like, well, I'm the vice president of product, so I know what's best. It's a really, really poor strategy in how to lead a team. I want to be the leader where anybody can come up to me and say, I'm worried that this is happening, or I think we should go this way. And we can have that healthy conversation. If I would be worried if when we're designing a product release, if we didn't have good dialogue and healthy back and forth with all team members about where we should go. I would be very worried if I said we should go somewhere and not a single person had a condescending opinion about that or thought we should go differently. I think that creates a poor product strategy. So that's my approach.
Where can our audience find you? Are you active on social media?
Yeah, so I'm on LinkedIn, Sarah Bell on LinkedIn. And yeah, happy. I love virtual care. I love the product space, the generative AI space, and just have really enjoyed leveraging my knowledge from academic medicine and bringing it to this quick, fast-paced environment has just been an absolute blast for me.
Amazing. I mean, Sarah, thank you very much for joining us today.
Thank you.
Stay in touch with us. Subscribe to our podcast, give us a like, comment, or share. If you want to reach out personally, you can find me on LinkedIn and Instagram.